I'm Catherine Criswell. My career in women's health care has spanned 45 years, most of it with Providence Health System, ranging in roles from staff nurse to executive leadership. I will tell you about an innovation project that improves maternity care for women and families. First, a little context. From early times, the tragic consequences of complicated childbirth cause us to seek innovation options to improve outcomes. We must remember, though, that 75% of pregnancies are normal, and there are excellent outcomes through the process of normal labor and birth. In Europe, 70% of women successfully deliver with midwives, often at home. In the US, most births occur in hospitals, attended by physicians, where the cesarean section rate ranges from 7 to 70%. Looking at average rates in the United States, we see the broad use of interventions in the birth process with no evidence to support these widespread applications. In fact, there's strong evidence to suggest the negative consequences of them. In the US, we spend 3 to 4 times more on normal delivery than in Western Europe, and maternal mortality is 4 to 5 times greater, and we have made no impact on maternal mortality since 1982. During pregnancy, a woman often interacts singularly with her physician, usually 10 to 12 visits of 7 to 10 minutes each. Her experience is distilled to images and numbers. The focus is on technology, often excluding participation by her family. Contrast this with the caring and joy of families preparing for birth together, the warmth of touch, and the gift of time and attention, with focus on the family. Similarly, at birth, we intervene in the natural processes. We start labor medically, we keep mothers in bed and constantly monitor them. Provider focuses on screens and on numbers. We impede her ability to do the work of labor by giving her anesthetics that often lead to the cesarean section, that isolates her and creates an experience of fear. Consider another option for birth, an experience that is joyous, almost reverent, including honoring the strength and capability of women. I wonder which of today's innovations will be tomorrow's discarded practices. I wonder about the harm that's done in between. Like forceps for birth, lauded and liberally used in the 50s, and now almost completely abandoned in modern obstetrics because of the injuries, I'm sure you can think of many innovations that have created unintended consequences. It is the innovator's obligation to question everything and to look for better ways, but it also is to foreshadow possible unintended consequences. Just because we can do something doesn't mean we should. Changes in OB practices seem to be on this swinging continuum. Today's women are not the first to push back. Remember our bodies ourselves in the 60s that changed everything about obstetrics in the 70s. Today's focus is on the convergence of cost, quality, and patient experience, and hopefully will bring the pendulum to a rational center. It presents a great opportunity to look and to evaluate and evolve maternity care. I've been fortunate to be involved in an innovations project at Providence to create a new model of care. Our objective was to develop a model that patients love, that achieves great outcomes, and that reduces cost. In brief, the model pulls together maternity care elements that may be available on their own, but not in one comprehensive care bundle. Patients receive coordinated care from the first point of pregnancy through 6 weeks. They do this in community with their caregivers and with other women. It's a team-based model of care led by certified nurse midwives. The integrated model includes the doulas, the navigators, and the social workers. The team cares for the patient across the entire continuum, and each of them practice at the top of their license. The model combines group and one-on-one visits. Patients may need and have a consultation with an obstetrician. Medical interventions are available to assure safety, but it's our shared view that pregnancy and birth are normal events, not disease to be treated. The model of care has been demonstrated with 600 patients since January of 2013. We've tracked over 50 metrics, and we've seen excellent results in cost, satisfaction, and quality. Our patients have less medication. They're highly satisfied. Our clinic has grown 20% since we started, and our outcomes support the replication and spread of our model. Birth must be safe, but it also must be a time of joy, a time when families share a remarkable experience together that forges a bond and strengthens the fabric of the family. This is the foundation on which we will build healthier communities together.